So thanks for the opportunity to speak. I realize that I'm an obstetrician talking to people who are not in obstetrics. So I tried to think about some of the most common questions, and I'd really appreciate some feedback. This is going to be hopefully a little bit interactive. So I'm going to have 3 questions. And the first question is, are pregnant women with COVID more likely to have severe disease when compared to non-pregnant women? So if you could just either in the chat or just unmute yourself and let me know what you think the answer to this is. Any responses? Are pregnant women more likely to have severe disease compared to non-pregnant women? Yes, no, maybe, don't know.
Lots of yeses are listed.
Lots of yeses. Okay, very helpful. Thank you. Yes, that is correct. So at the very beginning of the pandemic, we were saying that pregnant women were not at increased risk. We had no evidence that pregnant women were at increased risk of severe disease. So what changed? Well, this was an early report from WHO China. Interestingly, this was just a few sentences in a very long report. And it said that basically when you looked at mild, severe, and critical disease, pregnant women looked to do better. They were more likely to have mild disease, less likely to have severe disease, less likely to be critically ill than the rest of the population. The problem, of course, with this report was that they were comparing relatively young, healthy pregnant women to all people with COVID. So they didn't adjust for age or other underlying medical conditions. So and there were a bunch of case series from New York City and elsewhere of pregnant women, but none had a proper comparison group. This was one of the earliest looks at pregnant women, comparing pregnant women to non-pregnant women, but age matched. And when they did that, they did see an increased risk of severe disease. And they looked at it several different ways. They made several different assumptions, and basically no matter how they looked at it, there was some increased risk of admission to intensive care in pregnant women compared to non-pregnant women. Now you'll notice in the footnote that it was extraordinarily small, this study. It only included 53 women, 13 of whom were pregnant. So very small numbers, but it was a relatively representative group from Sweden. It was from their surveillance system. So this is the best, most complete data that we have about whether or not pregnant women are more likely to have severe disease. And it comes from the CDC's National Surveillance System of all case reports. Now you'll notice that almost 3/4 of the reports to the CDC were missing pregnancy status. So although there are a lot of pregnant women in this report, 8,000 pregnant women, there was a lot of missing data. So the data are still not perfect or even close to perfect. But what they did find is when they compared pregnant women with non-pregnant women and they adjusted for age and underlying medical conditions, as well as race, ethnicity, pregnant women compared to non-pregnant women were more likely to be hospitalized. They were more likely to be admitted to the ICU, more likely to require mechanical ventilation, no increased risk of death. Now, you have to remember that this group included pregnant women who were admitted to labor and delivery units and were tested just because they were admitted to labor and delivery. So they were hospitalized, not because they had a COVID-related condition, but they were hospitalized because they were about to give birth. So this hospitalization number is abnormally large. However, if you take out women who were otherwise healthy and just tested for COVID, likely asymptomatic, and admitted only because they were there for delivery, you would expect that ICU admission and mechanical ventilation the risk would go up because you're removing all the healthy women who are hospitalized. So your risk of hospitalization would go down, but you would expect that ICU and mechanical ventilation would go up. But despite that, there are a lot of shortcomings to the data, but these are the best data that we have currently available to answer that question. And so our best answer is yes, we believe that pregnant women are more likely to have severe disease based on the limited information that we have. So question number 2, can COVID positive pregnant women transmit COVID to the fetus during pregnancy or delivery? How about during breastfeeding? So either answer in your chat or unmute yourself. Yes, no, maybe, yes and no, yes to one, no to the other, vice versa.
We're getting mostly yeses.
Mostly yeses. Yep, that's that is also correct. So there had been several case series, and I won't go through all of those, but there had been accumulating case series where there was not evidence of intrauterine transmission. But recently we have had papers with probable intrauterine transmission. So if you think about it, with all the millions of cases that we've had, we have just a handful of cases of probable transmission. So yes, it occurs. That's what we'd expect. Most viral diseases, maternal viral diseases, can be transmitted intrauterine. Even flu can. It doesn't happen very often, and it doesn't seem to happen very often with COVID. So this is one of 2 reports that provides evidence, fairly good evidence, that SARS-CoV-2 can be transmitted congenitally. This was in a symptomatic 40-year-old mother who happened to have familial neutropenia, who tested positive at 35 weeks gestation. She had a cesarean delivery. The placenta had areas of infiltration by inflammatory cells and early infarction, and was positive for SARS-CoV-2. And we have seen in placentas there is evidence of pathology in the placenta, and SARS-CoV-2 can be isolated from placentas. The baby's nasopharyngeal swabs were positive at day 0, 2, and 7, plasma positive day 4, stool positive day 7. Since the baby was delivered by cesarean, the baby was not in contact with vaginal secretions. The membranes were intact before delivery, and there was no skin-to-skin contact with the mother before the first swab collection. That's been another issue. If the baby is in contact with the mother before the samples are collected, it could be that the virus was transmitted after delivery. The baby had feeding difficulties, intermittent hypoglycemia, neutropenia, mild hypothermia, but was discharged home on day 4 of life. This, I think, it provides the most complete and compelling evidence to date of perinatal transmission. This, again, was a cesarean delivery at 35 weeks for a non-reassuring fetal heart rate tracing. The membranes were intact. The amniotic fluid was positive. The neonate was resuscitated, intubated, and isolated right at birth. The samples at birth were positive. Nasopharyngeal and rectal swabs were positive at 1 hour, days 3 and 18. On day of life 3, the neonate had irritability, poor feeding, axial hypotonia, and apisthetonis. There was gradual recovery, and the baby was discharged home on day of life number 18. And according to this report in Nature Communications, the baby was followed up at 2 months of life and showed further improvement. So again, we think in utero and intrapartum transmission occurs, but it probably is, it likely happens rarely. What about breast milk? Can SARS-CoV-2 be transmitted through breast milk? There had been numerous papers with testing of breast milk, and none of them were able to identify virus in breast milk, but there was this article published in The Lancet with a positive result in 1 patient. A mother who had mild symptoms of COVID 6 days after birth. She was breastfeeding. She wore a surgical mask with careful hand and breast hygiene during feeding. Her breast milk was tested 7 times, and she was positive for SARS-CoV-2 on 4 consecutive days. The baby developed icterus breathing problems, had trouble oxygenating, and tested positive for SARS-CoV-2 and RSV. So it's unclear if transmission was through breast milk, but there was virus detected in breast milk. So third question, does COVID affect the risk of preterm delivery? Yes, no, maybe, don't know.
We're getting yeses.
Yes, okay, great, thank you. The answer is definitely yes. Well, the answer is likely yes. COVID affects the risk of preterm delivery, but maybe not in the way you'd expect. So this was a cohort of 241 pregnant women at 5 New York City hospitals. The preterm birth rate was higher in the patients with COVID. This is consistent with other studies. Oftentimes with maternal viral illness, it doesn't have to be a direct effect of the virus. Sometimes just having the mother be ill and febrile during pregnancy, during intrapartum, during labor and delivery, affects the risks. So we know, for example, with influenza, that when a mother is severely ill, she's more likely to have a preterm birth. So that makes perfect sense. What's the strange part of this is that these are 2 papers that were both published pre-publication. I have not yet seen them in the peer-reviewed literature, but 2 different countries, Ireland and I'm blanking on the other one right now. Oh, Denmark. Have seen fairly marked reductions in overall preterm birth rates since lockdown. And these differences are mostly due to those most extremely premature infants, which is quite surprising because we have been trying to figure out in obstetrics the causes of preterm birth and ways to prevent preterm births for decades, and we have been largely unsuccessful. The authors hypothesized that the decrease in preterm birth may be due to decreased stress, better family support, more people around, avoiding infections. Women are not out and about in the community getting other infectious diseases. Maybe they're having more opportunity to sleep or nutritional improvements. Maybe they're less exposed to environmental issues such as air pollutants. Is there less financial strain in these countries that have strong safety nets? I don't know. When I saw these, I was completely dumbfounded because it seems to me that the lockdowns and all the stress due to COVID would increase the preterm delivery rate in our country. But anyway, it's very interesting. It'll be interesting to see if these papers come out in the peer-reviewed literature. And the question is, could this information help us finally figure out how to prevent preterm birth, which has been a vexing issue in our field for decades?
One quick question, a couple quick questions, and that is any risk of miscarriage in early pregnancy, and should COVID be added to the other torch illnesses?
So, good questions. So, in terms of first trimester infection and miscarriage, we don't know. So we have very limited information about infection in the first trimester, or the first part of pregnancy. The risk of miscarriage is very hard to sort out because we don't have, many miscarriages are not even identified as miscarriages. And so when you try to study the effect of infections in miscarriage, it is quite tricky to sort out. In fact, our best information about miscarriage comes from assisted reproductive technology, or IVF, because then you know exactly when the embryo was transplanted, and those pregnancies are followed very carefully with ultrasound monitoring. So you have a precise estimate of miscarriage. So there is a group out of California that's doing a study with women undergoing IVF and the risk of COVID in early pregnancy. But right now we don't have a lot of information. The second question, what was the second question?
Torch.
Oh, torch. So yeah, it is interesting. So it's not one of the viruses that is transmitted with frequency. And it's also not one like Zika that causes a very specific congenital syndrome, as far as we know. So it seems to be more along the lines of influenza, where there have been reports of H5N1 influenza, which is very pathogenic, being transmitted, but it's not common, it's rare. So I would say it's probably not going to turn out to be one of the more significant viruses that is easily transmitted from mother to fetus. So I would not put it in the torch category. Just wanted to mention briefly, this is a JAMA article that I wrote with a colleague and was published the beginning of June online. It's funny because things change so rapidly that most of what's in here is correct, but there's one piece about treatment with steroids. At the time we published this, there was some concern that steroid use, which corticosteroids are used for fetal lung maturity, might be a problem in pregnancy, might be a problem in COVID. And so we were cautious about using steroids in pregnancy. And now it looks like there may actually be a benefit of using steroids with COVID. So I know I'm over time, but I'm happy to take any remaining questions.